According to the American Webster Dictionary, the word acceptance means the act of accepting or approval. We're going to be talking about that today.
Welcome to An Apple a Day, a podcast, a resource, a community. Share your experiences and learn from others as we overcome barriers and learn to live a happy, healthy life with a disability. Welcome to the community. Here's your host, Jimmy Apple.
How accepting are you of other people? Do you accept the way that they look? Do you accept the way that they speak? Do you accept the job they do? Do you accept the way they act towards you? Do you accept the way that they move around? Do you accept that they have other friends besides you? And what about you? Do you accept yourself? Do you accept the fact that you have a disability? Do you accept the fact that you have limitations in front of you? Do you accept the fact that you have to work harder at certain things? We're going to talk about that today. This is not just for disabled people, though. This is also for people right now who are suffering from being locked down because of the COVID-19, people that are home sick. It affects everybody. How you accept yourself. We're also going to be discussing a press release from the Department of Social Security about new disability investigations units. They're investigating fraud, so you're going to want to listen to that. We also have another announcement from Social Security about program experts who can answer all your important questions. And for those of us who are type 2 diabetics, I've got some very important news that you're going to want to stick around to hear. It's about a diabetes drug used for type 2 diabetics that's been recalled because it's known to cause cancer. It has a cancer-causing agent in it. So you're going to want to stick around for that. Very important. And we're going to discuss a couple other things, but you know what? Sit back, relax. I want to remind you before we go on that my name is Jimmy Apple. I'm your host for this Apple a Day podcast. And An Apple a Day is brought to you by www.famousapple.com. Famousapple.com is the home site for this podcast. So if you get a minute, go over there, check it out. Also, I definitely want you to check out our Facebook group, Living with a Disability. It's phenomenal. The numbers are growing daily. People are joining from all over the world. Africa, Asia, America, Canada, England, Ireland, Italy. We have them all. And the numbers just keep growing every day. I want you to be a part of it. So go over to www.facebook.com/groups/disabled living. That's going to bring you to the group page, Living with a Disability. It's an Apple a Day page. So join in. We don't keep any personal information on you. We're just a group of people helping each other out, having some fun, having some conversations. So go over there. Remember, it's www.facebook.com/groups/disabled living. You won't be sorry. Go over there, check it out. Become part of the community. All right, sit back, relax, and let's get started here. We're going to start with a couple of pieces of information from the Department of Social Security. This first one, the press release, I applaud this. If there's one thing that sticks in my side is people that are committing fraud against the Department of Social Security Disability Unit. People with real disabilities have to jump through hoops to get the benefits they need. Meanwhile, there's people out there that think this is some kind of chump change program that you can just get some free money from. Well, Social Security is cracking down on it. This is a press release from the press office on Wednesday, September 30th, 2020. It says the Social Security Administration and its Office of the Inspector General, OIG, announced 4 new Cooperative Disability Investigations, CDI, units opened across the country. CDI units identify, investigate, and prevent Social Security disability fraud and are very successful part of the agency's anti-fraud initiative. 4 new statewide offices recently opened across the country in Cheyenne, Wyoming, Las Vegas, Nevada, Manchester, New Hampshire, and Omaha, Nebraska. The CDI program helps to ensure the integrity of the federal disability programs by resolving questions of potential fraud before benefits are ever even paid. The innovative initiative continues to be successful by bringing together personnel from Social Security, its OIG, State Disability Determination Services, or the DDS, and local law enforcement agencies to investigate and analyze suspicious or questionable Social Security claims. CDI unit efforts assist disability examiners by making informed decisions to ensure payment accuracy and generate significant taxpayer savings for both federal and state programs. Social Security has a zero tolerance for fraud, and the CDI program serves in a vital role detecting potential fraud and preventing it, said Andrew Saul, Commissioner for Social Security. We tirelessly work at national and local levels to stop would-be crooks and continue to be good stewards of the taxpayer money by protecting the integrity of our programs. The CDI program consists of 49 units covering 44 states, the District of Columbia, and U.S. territories. Social Security and OIG have opened up many units in the last few years as they work together to provide CDI coverage for all 50 states by 2022. For more than 20 years, CDI investigations have made significant impact on the integrity of Social Security disability programs and provides critical evidence for those making disability determinations, said Gail S. Enos, the Inspector General for Social Security. Through this investigative work, we have saved an estimated $7 billion and helped deter those who fraudulently seek to receive and retain benefits. We welcome Nebraska, Nevada, New Hampshire, and Wyoming as they join in this important endeavor. Important is an understatement. I can't tell you how many people have asked me over the years, how do I go about getting Social Security disability? Well, I'm going to let you in on a secret. I never let anyone else in on this secret before. But if you really want to know how you can collect Social Security disability for the rest of your life, write this down. I hope you got a piece of paper and a pencil. Write this down. Walk, don't run, walk to your closest highway. Wait for traffic to really build up, and then just mosey on across the lanes and see who hits you. Okay? If that's what you really want out of life, is to be injured and disabled, go get hit by a truck. If not, work for a living. No one on Social Security wants to be on Social Security. Only those people on the outside looking in think it's some kind of gravy train. It's not. It's not. It's a fixed income that you have to support your family on, that you have to put a roof over your head, that you have to be able to buy medication, that you have to be able to pay for food, not to mention your kids' schooling, clothes, you name it. It's a fixed income. It's not pocket money. Maybe to you it's pocket money because you think you're going to continue to work and collect this on the side. Remember, with Social Security comes disability, and the disability is an injury, something that's taken away from your quality of life. There's pain involved. There's treatments. You think it's not just collecting a check. God, you want to switch places with me? Cut off your leg. Get me another leg. Take away my strokes and my heart attacks. Take away all the other problems that I'm having. All right? I'll switch places with you. You take all my problems and I'll take your job. Okay? How does that work? How does that sound for you? To me, that sounds great. I know that I'm more than just a check in my mind. Unfortunately, I've had some bad incidents happening to me. I've had several strokes. I've had heart attacks. I have nerve damage. I can no longer walk. I have to use a wheelchair. I had my leg amputated twice. Sounds like a barrel of monkeys, doesn't it? It's worth that money. Go ahead. You want to trade with me? I'll trade with you. Cut off your leg. That's all I'm going to ask you to do. Forget the heart attacks and the strokes. Forget the nerve damage. Forget the fact that you can only see out of one eye. Forget that. Just cut your leg off and be bound to a wheelchair for the rest of your life. And tell me what a good deal it is to collect Social Security disability. Now, don't get me wrong. I thank God for it because it helps me to take care of my family. But if I'm able-bodied I'm not going to try and take it away from someone else that actually needs it. If I'm able-bodied, I'm going to make it on my own. And if you can't make more on your own than what people make on Social Security disability, maybe you do have some mental problems. Maybe you do have some serious problems. Either that or you're just lazy and you're looking for the easy way out, which is what it sounds like when you say you want to collect Social Security disability. But for me, if I see someone committing fraud, I report it. If I know of anybody committing a fraud against Social Security disability, I report it. The reason being is because people who have real disabilities are forced to jump through hoops and live in poverty before they can get Social Security disability. Meanwhile, you got these people that don't need it, that are working jobs off the books somewhere, under the table, and they're looking for extra pocket change. It's not right. So I'm asking everybody, if you see someone that you know that's committing a fraud against the Department of Social Security disability or any workers' comp or anything like that, report it. Report it. It's not fair. It's not fair to those who really, truly, honestly need it. I have no sympathy for these lazy bastards that are just looking to grab money wherever they can get it for free without working for it. Okay? Now let's move on to the next Social Security notice. It's Social Security program experts can answer your important questions. There are many online resources about Social Security, so it is important that you come to us as the first place for answers. You can find many of the answers about our programs and services on our Frequently Asked Questions page. We feature our most asked questions at the top of the page to help you find answers to the most common questions quickly, like, are Social Security services affected by COVID-19? What should I do if I receive a call from someone claiming to be a Social Security employee? How do I change or correct my name on my Social Security number card? How do I apply for a new or replacement Social Security number card? How can I get Social Security statements that show a record of my earnings and an estimate of my future benefits? You can also browse topics like disability, Social Security payments, retirement, Medicare, etc. You can visit our publications library for detailed information on nearly all of our topics. We make each publication available in text, audio, and downloadable formats. For more information, you can go to www.ssa.gov. That's www.ssa.gov. It's a very informative site. So, get a chance, go over there, check it out. Better than watching TV, my friends. All right, let's move on here. Do you have everything you want? I know I don't. I don't have everything I want. But do you want everything that you have? Very important. You may not get everything you want. There's a song out there, country song. It says, some of God's greatest gifts are unanswered prayers. Well, sometimes the things that we want aren't good for us. But the things that we have to take care of. We have to want the things that we have. For example, and I'm going to use myself as an example. I want to have 2 legs. I don't. I have one. But I want the one leg I have. I want to make it stronger, so this way I can get around a little bit easier. The minute I don't accept the fact that I only have one leg and just lay down and say, this is it, I don't accept this, that's when everything stops. The same holds true for everything in life. The people that are fighting about wearing a mask because of COVID-19, it's a fact of life. You don't want to wear a mask, but you have to wear a mask to save your life. So accept it. I know you want to go back out to bars, you want to go to movies, you want to go to restaurants, church, synagogues, you want to go to school, those are all things that everybody wants. But unfortunately, right now we have to accept the fact that we can't do that. So the minute you accept it and follow the rules, just think, if everyone accepted the fact that they had to wear a mask, we wouldn't have these resurgence coming back. If everyone wore the mask, we'd be months ahead of this already. But instead, people just don't want to wear the mask. They refuse to accept the fact that they have to wear a mask. They think it's a hoax. They think it's this. They think it's that. Accept the fact that it's here. Accept the fact that there's a deadly disease. And to stop the deadly disease, you have to wear a mask. It's one of the things. It's not foolproof, but it's something. So you accept that. The same thing with disabled people. All right, you have a disability. Your life is never going to go back to the way it was. Never. Whatever happened that put you into having a disability has changed your life forever. Now you got two choices. You can accept that and move on, or you cannot accept it, lay down, and wait for someone to close the box and start throwing dirt on top of you. The minute you don't accept, when you don't accept the situation that you're in, that's the end. It stops. The minute you do accept it, you can start looking for ways around the roadblocks that are ahead of you. And believe me, every roadblock that's there, there's a way to get around it, over it, or under it, but there's a way to pass it. Just accept the situation you're in and move forward. If you don't accept yourself, how in the hell is anyone else ever going to accept you? If you hide yourself and say, well, I don't want to be out in public, how do you know the public's not going to accept you? You have to accept yourself. It's like they say, love yourself. Accept the position you're in, make it better, okay? Let's move on. This is very important. If you or someone you know is a type 2 diabetic, listen to this. The diabetic drug metformin hydrochloride has been recalled because it contains excess levels of a cancer-causing agent, the U.S. Food and Drug Administration announced this week. The drug's manufacturer, Marksans Pharma Limited, has expanded a recall initially announced in June to now include an additional 76 unexpired lots of the medication. The recalled drugs are marked as extended-release tablets under the brand name Time Cap Labs Incorporated. The drug helps lower the blood glucose levels of those with type 2 diabetes, but the recalled product contains an unacceptably high level of NDMA, which is considered a probable human carcinogen. Marksans performed an NDMA testing of an unexpired identified marketed lots and observed that NDMA content in some lots is exceeding the acceptable daily intake allowance. Therefore, out of an abundance of caution, an additional 76 lots are being recalled. The recall applies to metformin tablets between 500 milligrams and 750 milligrams. The 500 milligram tablets are debossed with the number 101 on one side. The 750 milligram tablets are debossed with the number 102 on one side. The FDA advises users to continue taking the recalled tablets until medical professionals provide a replacement or alternative treatment option. It could be dangerous for patients with type 2 diabetes to stop taking metformin without first talking to their healthcare professional, the FDA said in a statement. Consumers should contact their physician or healthcare provider if they have experienced any problems that may be related to taking this drug. Check your prescriptions. Call your doctor. Metformin is a common drug. I was on metformin for years. It's a common drug that they give you for diabetes. So check your lots, check your lot numbers, check the pills for those markings, and call your doctor. Don't stop taking them. Do not, I repeat, do not stop taking them until you speak with your doctor. Don't stop taking any drug without the consent of your doctor. Make sure there's another plan in place for you. Okay? Very important. And share this with your friends. This will be on the groups page. This is on the groups page at www.facebook.com/groups/disabled living. This whole article is posted on that page for you to read. So make sure you share it with others. Share it on Facebook. Let them know what's going on out there with metformin. Okay? Let's move on. I want to thank you for stopping by today, and I want to remind you that things can always be worse. That's right. No matter what, things can always be worse. Right now, there's somebody somewhere wishing that they were in your position. So things can always be worse, my friends. And nobody ever went blind by looking at things from the bright side. Try it. You'll like it. Hey, let me know what you think about our breaks here with the music instead of the bongo drums. Go on to www.facebook.com/groups/disabled living and tell us what you think about the music breaks instead of the bongo drums. Thanks again for stopping by today. And we have some good stuff coming up in the next couple of weeks you're not going to want to miss. Listen during the week for little apple slices coming out, telling you what's coming up and what days they're coming up on. So you're not going to want to miss it. You're part of our community. Remain part of the community. Subscribe to this podcast. All right. Thanks again. You've been listening to An Apple a Day. My name is Jimmy Apple. And remember this, the best medicine you can have for anything that ails you is laughter.
Thanks for listening to An Apple a Day with Jimmy Apple, your gateway to a happy, healthy life. Join our community at www.famousapple.com. See you next time.